old red blood cells rupture, the released hemoglobin is ingested by macrophages. The globin chains of hemoglobin are broken down to individual amino acids that are metabolized or used to build new proteins. Iron is released from the heme of hemoglobin. The remaining structure is converted to biliverdin, which is then converted into bilirubin. Iron is transported by transferrin in the blood to various tissues for storage, or to red bone marrow for making new hemoglobin. Free bilirubin is transported by albumin in the blood to the liver. Liver cells make conjugated bilirubin, which is excreted as part of the bile into the small intestine. Intestinal bacteria convert bilirubin into bilirubin derivatives, which contribute to the color of feces. Some of the bilirubin derivatives are absorbed into the blood and excreted from the kidneys in the urine.
Urine is formed by 3 processes in the nephron, the functional part of the kidney. In glomerular filtration, the glomerulus filters water and certain dissolved substances from the plasma of the blood. This results in increased blood pressure, which forces the plasma-like fluid from the blood into Bowman's capsule and then into the tubules. The fluid or filtrate include many positive and negative ions of many elements. The filtrate does not have any proteins or red blood cells, which are too large to pass through the capillary membrane. In tubular reabsorption, substances are transported out of the tubules and back into the blood of the peritubular capillaries. Reabsorption takes place in the proximal tubule, loop of Henle, and distal tubule. The major part of reabsorption occurs in the proximal tubule. About 15% of water is reabsorbed back into the bloodstream. The process is regulated by the hormones vasopressin and aldosterone. In tubular secretion, substances move from the plasma in the peritubular capillaries back into the filtrate in the renal tubules. The proximal tubule secretes creatinine and histamine, and the distal tubule and collecting duct secrete potassium into the filtrate. All the tubules actively secrete hydrogen ions to regulate the pH of the body fluids. The filtrate is now urine. Urine is about 95% water with a balanced urea, uric acid, amino acids, and electrolytes. The daily production is about 0.6 to 2.5 liters per day. Urine production below 30 milliliters per hour indicates possible kidney failure.
When George and Rosie Douglas had their first child, Johnny, they couldn't have been more happy. It was a difficult labor and cesarean section delivery, but when it was over, they had a healthy 9-pound little boy. But a day after Johnny was born, when their pediatrician told them Johnny had jaundice, they were both a little worried.
A friend had a little boy, and he had jaundice too, and he was in the hospital for a week. So that was really concerning after hearing that story.
Jaundice occurs when the red blood cells in the body are broken down too quickly for the baby's liver to handle it. As the red blood cells die, the oxygen-carrying hemoglobin contained in them is converted to a yellow substance called bilirubin. It's this high bilirubin level that causes jaundice.
When it gets high, it can get into the brain, and for reasons, again, that we don't fully understand, can stay in the brain. When it does that, it can be toxic to the brain cells. It can actually cause damage.
60% of newborns in the United States become clinically jaundiced. In Johnny's case, as with many cases of jaundice in newborns, the pediatrician recommended that Johnny be placed in a special bed under fluorescent lights designed to convert the bilirubin into a form easier for his liver to eliminate.
Well, they rolled in the machines and all these lights, and they were setting it up. Yeah, it's kind of unnerving, but once he was in there, it was fine.
And for Johnny, that was the end of the story. His bilirubin level dropped, and his pediatrician continued to monitor him for about 3 weeks. That care and concern obviously paid off.
He's doing great. He has no issues about that anymore, and he's growing and he's healthy, thank God, and he's doing wonderful.
Baby is a bit jaundiced, actually.
Since bilirubin usually develops between 36 to 72 hours after a baby is born, it's important that parents stay in contact with their pediatrician in the early days after birth to check their babies for signs of jaundice.
Home tomorrow, and he's now 36 hours old. Looks like your nursing is going well. Well, you've been nursing him great, like 8 to 10 times a day. That's perfect. That's exactly what we want. Now, we did check his jaundice level, his bilirubin level, and I just want to show you what I want you to keep an eye out for. You see that if you press his nose, he looks just a little tiny bit yellow. You can almost not see it, but there's a little bit of a yellow tinge when you press his nose like that, okay? And when you get home, if you see the color going down like that on his body, then you need to let us know.
What parents and caregivers should look for, especially in babies who are less than 40 weeks gestation, are signs of jaundice in the face or chest, if the baby seems lethargic, or if the baby is not feeding well. This situation should be carefully monitored by the pediatrician. As George and Rosie found out with Johnny, who is now 14 months old, having a pediatrician help you through the experience works wonders for your peace of mind.
It's always great when you have a professional tell you that not to worry, this is common among infants, and and they give you a procedure to follow, and you follow it. It's very comforting.
Water is essential for life. We take it in mainly by drinking and eating. But as well as gaining it, the body also loses it. You breathe out water vapour. And water vapour evaporates from your skin. It's most noticeable when you sweat. More obviously, you lose water through urine and feces. But despite these daily gains and losses, the body works hard to keep its internal body fluids at a constant concentration. The kidneys play an important role, producing more or less urine depending on how much water you've gained or lost. As well as sweating profusely for the past couple of hours, Lisa has had nothing to drink since yesterday, by now she'll be extremely dehydrated. One obvious sign is that she's producing very little urine, and it's dark in colour. On the other hand, Joanne has taken in lots of liquid over the past few hours. Her urine is plentiful and very pale. Her body is losing water, which means that she must be fully hydrated. The kidneys regulate the amount of urine produced. It's their job to keep body fluids, like your blood, at a constant volume and concentration. Blood flows in through the renal artery and out through the renal vein. Inside the kidney are millions of microscopic devices called nephrons. Blood entering each nephron is filtered. Most of its fluid content, represented here as yellow, passes into the nephron tube. As it trickles down, exactly the right amount of water is taken back to give the blood its correct volume. The remaining waste solution passes out as urine. So what will happen to Lisa and Joanne's urine levels if they both drink a litre of water? They continue to give samples every half hour. Lisa's urine is gradually getting paler, but she's still producing less than Joanne. In just 2 hours, Joanne has lost nearly all the water she took in. Her kidneys are getting rid of any excess fluid. When she drank a large quantity of water, her body fluid increased. This excess fluid appears in the blood. When it reaches the kidney, very little is reabsorbed into the bloodstream. Most of the water passes out as urine, bringing the blood volume back to normal. So if you're dehydrated, what's happening inside your kidneys?